Hello. So now we're going to continue with the second part of the chapter regarding medication for protozoal infections. So let me share my screen with you. And okay, let's start. So protozoal infections are parasite infections. Parasite infections. And the highlight parasite infections, this type of parasite infections, is that they are unicellular. That means they're the size of one cell. That means that they can get inside our cells and infect them. So obviously, we're not talking about the tapeworm or any other type of parasite that are more complex regarding cellular organization. Protozoal infections are the most common type of parasite infections. Unfortunately, we see them a lot in third world countries, but we're having an increase on those type of infections here in the United States. The most common parasite infections from this family of protozoa is Entomoeba histolytica, Trichomonas vaginalis, and Giardia lamblia. Those are the most common, but we have a big list here. So we have amoebiasis. It's a GI infection. Catarrhide. This type of parasite is a local. We can find it in contaminated food. Mode of transmission is by ingestion. Yardiasis also is a EI infection. This is by contaminated water, and amoebiasis is by contaminated food. From here, toxoplasmosis is a parasite that we can find on cat feces. Leishmaniasis, this is affects the skin and the heart. So this is one of the most serious protozoal infections that we can find. Chagas disease, also skin, heart. African trypanosomiasis, that's the sleeping sickness. In Africa, this one is transmitted by flies. And Trichomonas vaginalis. STD transmission. Okay, so like I was telling you, we're gonna emphasize basically the main three parasite infection that we have here in the United States, and that's trichomoniasis, that's STD, giardiasis, and amoebiasis. Those are GI infections, and we mentioned giardiasis. It's by food contamination. Sorry, giardiasis is water contamination, and amoebiasis is food contamination. As you can see, they're kind of similar regarding treatment. So it's very common that a lot of doctors here in the States, when they find out that it's a protozoal infection, they don't go much into the details of the parasite, and they just go directly with metronidazole. So far, we have mentioned that metronidazole is also used for cellular colitis. caused by Clostridium difficile or C. diff. Pseudomembranous colitis is a superinfection caused by antibiotics. When this happens, we already mentioned that we need to stop taking or the patient needs to stop taking the antibiotic, and then we'll substitute it with a metronidazole in order to kill C. diff. We have a bunch of drugs also to treat this type of parasites. We have ioquinol, metronidazole, tinidazole, benznidazole, nidasulfonide, and pentamidine. So as you can see, regarding metronidazole, we have variations of it that have mild adverse effects. Also, we have Suramin, Milorcipro, eflornithine, paramethamine, sodium stibogluconate, and miltefosine. Again, not very common here in the States regarding the treatment of protozoal infections. Metronidazole is the main one. So metronidazole has a broad spectrum activity. It can kill a lot of different types of microorganisms, and we have mentioned bacteria, and here we'll mention in parasites. So metronidazole regarding amoebiasis, it can be intestinal or systematic amoebiasis. Adverse effects regarding metronidazole, because when the medication is PO, MVD, we have to emphasize to a patient, you're going to have dry mouth, you're going to have a metallic aftertaste, and urine is going to be dark. So those are the last two that I mentioned, the metallic aftertaste and the darkening of the urine. That can be two reasons that if we don't explain to the patient what may happen, there's a reason for them to get scared and stop taking the medication. And the other highlight, metronidazole cannot be combined with any type of alcohol regarding their different presentations. And by this, I mean cough syrups. Why? Because we're going to have a disulfiram-like reaction. And we mentioned that disulfiram is a drug that is used on patients that want to stop drinking. So once they go to AA and they follow the 12 steps, the doctor will prescribe the disulfiram. And the thing is, they'll be taking the disulfiram, and then for some reason they say, hey, I want to celebrate. This is a very special occasion. I don't think I'm going to fall off the wagon. What drink? When they take that sip of alcohol, they'll start having severe nausea, vomiting, and headaches. Very severe, very unpleasant sensation. So that's what the doctor's looking to reprogram that patient, that every time they drink alcohol, instead of having a relaxed effect or euphoric effect, they have that unpleasant effect, and for them to stop drinking. So the same thing happens with metronidazole. Metronidazole, when it's mixed with alcohol, the patient will have severe headaches, nausea, and vomiting. So that's a highlight regarding patient teaching. Tinidazole, again, tinidazole sounds like metronidazole. So it can be used for protozoal infections. But here the author is highlighting, what, it can be used for trichomoniasis, as STD, and can be used for giardiasis, amoebiasis, and amoebic liver abscesses. This is now the systemic presentation of amoebiasis. And the same thing will be with benznidazole, metronidazole. So again, they have that azole ending that make us more comfortable saying, yeah, they are used for the same, with the same effects. Regarding this list, pentamidine, it will be the more severe drug that we can use if all these ones don't work for that patient. Pentamidine has severe effects regarding bone suppression and liver damage. Sorry there for the mental blackout. So pentamidine, we use it only as a last drug. Now, regarding the newest drugs, we have cerumen, also can be used for all three parasite infections, amoeba, giardia, and trichomonas. Medication, if it's by mouth, it's going to be MVD. And patient may have a little allergic reaction, so it'll be itching, rash, allergic reaction, and sunburns. So when they take in ceramide, we need to emphasize to the patient to use sunscreen if they're going to be going out, a hat, long sleeve, and so on. Millarceprol is one of the newest drugs also used for this type of infections, peripheral infections. The highlight of this is that it's a very toxic drug so far, and it produces neuropathy, myocardial damage, and hypertension. Regarding neuropathy, again, is neuropathy pain. So a patient's gonna tell you, I have this pain in my fingertips and my toes, that I feel like ants crawling underneath my skin, or like I have sand inside the skin, very uncomfortable. And then from there, it's gonna increase to sharp pain and eventually numbness. That's when the nerve dies. Regarding the heart, it's gonna produce arrhythmias. Here we have more options regarding drugs that we can use to treat peripheral infections, but the only one that I want to highlight right now is amphotericin B, and this is only used peripheral infections with severe impact on the body. You know, where, let's say the amoeba is an intestinal infection that when it's not treated right, or the patient ignore the symptoms, the amoeba can actually break the tissue of the intestine and travel to the liver. And again, this is because of the sign of a blood flow from the intestine to the liver. So they'll go to the liver, they can live there and make abscesses. They start destroying the tissue of the liver. The immune system is going to attack, and now the liver is going to have abscesses, it's going to have pus. And from there, the parasite can actually travel up to the lungs, and worst case scenario, to the heart, because of the vicinity of the organs. So in those cases, that's when I have to be aggressive. I have a systemic infection by amoeba, systemic amoebiasis, and that's when I use amphotericin B. And we mentioned already that amphotericin B is a very aggressive medication, very toxic, that we need to do the proper follow-up. For a review on amphotericin B, go to the chapter regarding the fungal drugs, or anti-mycotic drugs. Okay, so that will be all for this chapter. I'll be seeing you soon. Thank you very much for your attention.